for Bendigo.
Thank you, Deputy Speaker. And I just wanted to pick up where the previous member finished and just sort of say there's something else that the government can do to encourage people into the aged care workforce and domestic local workers, and that's to pay them properly. It's actually pay them a decent wage. One of the real reasons why we struggle to attract people with the skills, with the experience back into aged care or into aged care is because they are paid minimum wage. The solution to the aged care staffing crisis is not simply importing workers. It's not simply opening up our borders and attracting overseas workers to work and care for our elderly Australians. That is not enough. We will probably always require some element of overseas workers, skilled workers in our care sector, whilst we skill up our own, but it is not the only solution. It also fails to address that we have a skills crisis in this country across the board, and as the demand in the health sector under the COVID crisis has sucked a lot of workers into it, as it should. It is a pandemic and the demand for health workers and community workers continues to increase. It has left the aged care sector vulnerable. And without a plan, and there is no plan in this legislation to properly pay our aged care workers, this trend will continue. It is unsettling to hear government members speak about, we'll import the workers and they can be this second-class workforce, low-paid, do the work that Australians won't do, without recognising that we need to upskill the sector, that we need to properly fund the sector, that we need to properly pay our aged care workers. I do agree that our aged care workforce, they are angels. They do it because of a love. They do it because they genuinely want to see our older Australians live in dignity and have a wonderful exit. However, that doesn't pay the bills. However, that's not recognition of the skills that they have, of the compassion that they have. For far too long, our aged care workers have been left to do it for the love of it, and it's simply not good enough. Years ago, Labor in government moved reform with the agreements of the states to introduce ratios to our early childhood education sector. And my children are beneficiaries of that. Young Daisy is in childcare today in Parliament House, and she gets the benefit of having extra educators with her. We don't have something similar for our aged care sector. And one of the complaints that's raised with me so often in this space is the fact that we don't have ratios in our aged care facilities, that if somebody is sick, people aren't called in, if they in fact have people available to be called in. And the ratios vary from facility to facility. A state government-owned facility or a community not-for-profit aged care home will have better ratios than those in the for-profits. But because there are no rules in place, because there are no mandated safe staffing levels, we see ridiculous ratios where you may have one aged care worker to 50 or 60 residents. Now, how can they possibly do their job adequately if we don't have decent aged care ratios? And I raise that, Deputy Speaker, because that's what's not being dealt with in this bill. Whilst Labor supports what's before us, what we're arguing is it doesn't go far enough. We held a huge aged care royal commission in this country, and it did travel to Bendigo. It met with over 300 people in a community forum where local people got to share their experiences. But yet, in this bill that's before us, it doesn't deal with a number of the key recommendations in that report. The government, yet again, has fobbed off, delayed and outright rejected key recommendations from the Aged Care Royal Commission. Of the 148 recommendations, over half are not being implemented or aren't being implemented properly. Over half. We have all heard the heartbreaking stories. It could have been a moment of bipartisanship, it could have been a moment of recognition and healing, but most importantly, practical reform that give our older Australians the dignity, the support and the care that they needed. It's concerning that as we stand here today, the bill that's been before us, not only is it inadequate and not deal with what is necessary to help our older Australians, but it also too hasn't had the proper consultation required. Stakeholders, peak bodies, providers and workers are saying that they haven't been consulted in relation to this bill, despite it dealing with workforce screening, despite it dealing with provider governance, despite it dealing with banning orders and code of conduct. And, Deputy Speaker, as we know with this government, they are so quick to implement something without consultation that there's going to be issues. And I just hope that they're ready to reform where needed, where we run into those mistakes. These small changes are necessary and needed, but don't rush them. Don't do it without consultation, because we'll hit more problems in a sector which is already exhausted. They were last year the front line. They were exposed to the COVID-19 outbreak. We know the impact that COVID has had on the aged care sector, and it has been twofold. First, we knew that COVID had a greater impact on the health of older Australians. Those in aged care were vulnerable. So it's disappointing that the vaccine rollout was so delayed, because we know that the vaccine saves lives. But as the vaccine has rolled out, and there was a problem that the government didn't have the vaccines available for the workforce. So in my part of the world, when the contractor turned up to vaccinate older residents, and that was welcomed, they didn't have enough vaccine to vaccinate the staff. And so it fell to Bendigo Health to vaccinate the staff in our aged care facilities, and we thank them for doing so. But after and during last year and after the vaccine rollout, whilst we've been in and out of lockdown, our aged care facilities have, for health reasons, been the first to be locked down. And so we've had long periods now of where aged care residents have not been able to see their loved ones. And that's because we are in a pandemic. So our workforce have had to step up, and they have not only been the carers and the health providers, healthcare workers in these facilities, but they've also been the companions for many in these facilities. Residents are frustrated and heartbroken, and they are lonely. It's been long stints between seeing loved ones. Some may say it's the nature of a pandemic and there was nothing we could do, but what we need to recognise is during this difficult period, the workers in these facilities became their loved ones, their family members, became the comforters, became the people that they could have a face-to-face conversation with. This is where we need to be doing more to support this workforce. Older Australians have helped build this country. They've worked hard, they've paid their taxes. At a time when we promised them, if you pay your taxes now, we'll be there to care for you in later life. They've raised their families, and now in their later years deserve the respect and support that they from their government. They rightly expect the government to support them in their frailing years. But yet what we've seen from this government time and time again is they've consistently let this age group down. After 21 expert reports, they knew that older people were suffering in aged care, but they did very little to fix the problem. It took an aged care commission to bring these reforms before us, yet as I've already stated, the Aged Care Royal Commission recommendations of the 148, over half have not been implemented or aren't being implemented properly. The government has proven that they're incapable of fixing the aged care crisis, and hopefully in the months ahead they will listen to the sector, listen to the workers, listen to the unions, listen to the providers, and finally do something about the crisis that we're facing. I held my own inquiry into the aged care crisis that we're experiencing in my electorate, and I asked people what they thought of the reforms that Labor had put forward and whether they agreed with some of the suggestions that we were making. 90% agreed that there needed to be minimum staffing levels in aged care. 90% agreed. This is what they're saying in my part of the world, a regional electorate where we have multiple aged care providers from our small towns to the big regional centre. 90% of people who responded to my survey said that they agreed with minimum staffing levels. A Labor commitment, a recommendation from the Royal Commission into aged care, yet no reform that's before us in this House. 97% agreed that staff should be trained properly for aged care, recognising that not all people in aged care have had the opportunity for skills, have had the opportunity to train, have had the opportunity for the education required to be aged care providers. Again, this is something that Labor did in government for our early childhood education sector, but yet we haven't seen rolled out in aged care, something that's required. If COVID has taught us anything about aged care, it's that if you train the staff will have the skills that's required. 70% agreed in this survey that aged care facilities in our area did not have the appropriate or proper PPE required. And we asked the staff, and many reported having to go the whole day in the one mask or the whole day in the one PPE, which is not good infection control, as we know. 92% agree that we needed a better surge workforce strategy, highlighting the problems that we've experienced in our region. Staff are exhausted, Deputy Speaker. Many haven't been able to take any leave over the last 18 months to try and get through this pandemic. They deserve the support right now, and yet many don't know when they'll be able to take a day's leave or a week's leave or even go on a holiday with their family. 94% say that the home care waiting lists are still far too long. The government and government MPs come in here and crow about what they've achieved, but there are still people on the waiting list. I've had people in my electorate die waiting for the appropriate aged care package, and it's quite frankly simply not good enough. A level 2 package isn't the care that somebody on a level 4 package needs. And when the government crows about their packages, quite often what you find is what people have told me in my electorate is, I've been offered it too, but it nowhere near covers or satisfies what I need. Children are frustrated that their parents aren't getting the support that they require. Deputy Speaker, in the few moments I have left, I'd just like to share some of the experiences of what people said about what it's like to work in aged care in my electorate, and what some of the children have said. A daughter of a woman in aged care, now deceased, said to me that at the time staffing there was one registered nurse on per floor of 50 to 70 residents, one enrolled nurse and personal carers. On the night shift, one. How can they possibly do the work that's required? Another person who worked in the sector said inadequate staffing ratios led to inadequate service provision. I felt like I couldn't do my job. I went home tired, exhausted and heartbroken that I couldn't do the job required. Another aged care worker said to me that the things that you see and experience in the sector is just heartbreaking. The wages do not reflect what we do or what we go through. I don't think many workers in aged care are here for the long term. Many are thinking of the exit strategy, and that's just heartbreaking. We can only deliver the basics and not the emotional support that many in our care need. We can't wait for the findings of the Royal Commission. We need action now. And the heartbreaking thing, Deputy Speaker, is we have been forced to wait for the Royal Commission findings. We've got the findings, and yet still the bill before us doesn't deliver the reform that these workers, that these children are seeking. We have an opportunity to fix this once and for all and to really move the sector forward. What's needed is not just the minor reforms that the government have put forward. What's needed is strong reform. If we want to stop what is occurring in our aged care, to fix the aged care crisis, then we need to tackle the issue of wages. We need to fund the sector properly. We need to make sure that we have the skill mix right. And Deputy Speaker, just before I finish, I'd like to call you to the state of the House.
Is the quorum required?